Schizophrenia is a chronic brain disorder that affects about 1% of the population. When schizophrenia is active, symptoms can include delusions, hallucinations, trouble with thinking and concentration, and lack of motivation.
Although the DSM-5 no longer includes these 5 subtypes, catatonic, disorganized, paranoid, residual, and undifferentiated schizophrenia, it is still important to make note of them. The DSM-5 does require 2 of the 5 symptoms from the following subtypes to be present in order to receive a diagnosis of schizophrenia.
The predominant clinical features seen in the catatonic subtype involve disturbances in movement. Affected people may exhibit a dramatic reduction in activity. These symptoms highlight more of the depressive symptomology of the overall schizophrenic diagnosis, seeing as the patient is exhibiting a lack in movement, reaction, and receptiveness to their environment. Alternatively, activity can dramatically increase, a state known as catatonic excitement, while as a dramatic decrease would be known as a catatonic stupor. Organized schizophrenia essentially consists of disorganization in the person's speech and thought process. This category also includes significant impairments in the ability to maintain normal relationships and everyday functioning, such as bathing, maintaining oral hygiene, and dressing oneself. From an outside perspective, this subtype is slightly more difficult to recognize as an abnormal condition, since the side effects tend to include a more functional work and personal life. Included in the residual schizophrenic subtype, symptoms generally are lessened in severity. Hallucinations, delusions, or idiosyncratic behaviors may still be present, but their prevalence significantly diminishes. Undifferentiated or uncategorized schizophrenia is when symptoms are not adequately formed or specific enough to permit classification into one of the other different subtypes.
The causes of schizophrenia include genetics, biology, viral infections, and immune disorders. Genetically speaking, there is not one singular gene that causes schizophrenia. However, scientists have confirmed that genetic changes, also known as genetic mutations, can increase the likelihood of one being diagnosed with this condition. If somebody in your family has been diagnosed with schizophrenia, your chances to receive the same diagnosis are increased. If it's your parent, your brother, or sister, your chances are increased by 10%. If it's both your parents with a diagnosis, you have a 40% chance of receiving it as well. If it's your identical twin, however, your chances are at 50%. However, some people with schizophrenia have absolutely no history of it within their families. Some biological causes of schizophrenia include an imbalance in the complex, chemical reactions of the brain involving the neurotransmitters dopamine and glutamate, and other functions as well. People living with this diagnosis tend to have a slightly different brain structure than those living without. These differences can include those with schizophrenia to have larger ventricles and less gray matter within the brain. More causes of schizophrenia include viral infections and immune disorders. This includes prenatal viral infections, prenatal bacterial infections, and inflammation. Individuals born seropositive for bacterial and viral agents are at a significantly elevated risk of developing this disorder.
Here are some of the positive symptoms of schizophrenia. With disorganized speech and thought, disorganized thinking is inferred from disorganized speech. Communication can be impaired, and answers to questions may be partially or completely unrelated. Speech may include putting together meaningless words that can't be understood. Although childhood silliness and/or unpredictable agitation can be misinterpreted as regular child behavior, it can actually be a symptom of disorganized behavior. This form of behavior is not focused on a single goal, making it hard for individuals to complete a task. Resistance to instructions, inappropriate or bizarre posture, a complete lack of response, or useless and excessive movement are all forms of disorganized behavior. The most common and well-known positive symptom is hallucinations. This involves seeing or hearing things that don't exist. Individuals experience the full force and impact of a normal experience. Auditory hallucinations are the most common form, but not the only one. Another common and well-known positive symptom is delusions. They occur in most people with schizophrenia and are defined as false beliefs that are not based in reality. A lot of the time, there is confusion when it comes to the difference between hallucinations and delusions. So let's clear the air once and for all. Hallucinations versus delusions. Hallucinations involve hearing or seeing things that don't exist, whereas delusions involve false beliefs that are not at all based in reality. An example of hallucinating could be a man standing in a completely empty room and is seeing and interacting with floating vehicles. These vehicles do not actually exist, they are just part of the hallucination. An example of a delusion could be a man believing that a woman, let's call her Ava, is in love with him. Ava has never met this man before, yet he believes that this stranger has a deep affection for him. This is a false belief. Here we have the negative symptoms, which have an indirect impact on the individual's social life, behavior, and performance of activities. Early warning signs are a mixture of positive and negative symptoms. Their effects have drastic consequences on the performance of everyday tasks, behavioral traits, and social competence. Here's a list of the early warning signs. Anyone who experiences several of these symptoms for more than 2 weeks should seek help immediately. If you or someone you know are in crisis, call 1-800-273-TALK. Go to your local emergency room or call 911. Coping with a mental disorder as serious as schizophrenia can be challenging, both for the person with the condition and for friends and family. Here are some ways to cope. You can learn about schizophrenia, join a support group, stay focused on goals, ask about social services assistance, learn relaxation and stress management, prevention, and perseverance. Again, we encourage you, if you or someone you know are in crisis, call 1-800-273-TALK.